For over 30 years. He worked in Boston and kind of the DC area. And he served as an assistant surgeon general and a senior program director for applied research. He's done work with expanding health insurance for children, reducing infant mortality, and improving environmental health. And then he also has done work with childhood overweight and obesity issues. So he's spent his career doing what we will be talking about for the rest of this semester. So,
Thank you. If it's any good. I am Woody Kessel. What we'll do is we'll spend the next 3 or 4 or 5 hours. You don't have anything to do till. There's nothing good on tonight, is there? What's on tonight? Must be one of those shows. Dancing with Somebody is on tonight. The Emmys the other night. Anyway, we'll be here till you can't take it anymore. I want to give you some orientation about children, about children's health. And despite what Tim said, it sounded like past tense. I am a pediatrician. It's not present tense. I no longer work for the United States federal government. I'm a professor of practice here in the School of Public Health. And to get started, I want you to tell me your name, your year, your major, and some fact that nobody else knows that you have to reveal. Over here. Start here. Oh, yes. Anybody have a clue what language this is? It's always a good answer. I don't think there's enough vowels exposed usually. What this means is this is a greeting between Maasai tribal warriors. And it's Swahili. And it means, how are the children? Has anybody been to Kenya, to Maasai Mara? I was fortunate enough to go. And it's interesting to talk to people of different cultures, different backgrounds, different places. What this means is a greeting. Is instead of saying, how are you, it's how are the children. It's valuing the children, it's valuing the future, it's valuing families. And it's just interesting. We don't typically do that in this country. And hopefully, if we ever get anything running, we'll do this as quickly as we can. This is the question that when I'm through, maybe you'll have a better sense of what an answer might be. And you can think about some special projects. What's special about children? Purity. What? Purity. Good answer. Any other answers? I mean, since I can't read half the slides, you're going to have to... Honesty. Yeah. Honesty. What else? Future. Dependence. Anything else? Growth.
Optimism.
Curiosity. All wonderful comments. As a pediatrician, the underlying philosophy of pediatrics is children, one, are special, have all the characteristics that you talked about. But what makes them different from adults is vulnerability. Why? Why is there a special vulnerability? Still developing. Who's it? Good for you. The fundamental distinguishing characteristic for kids is that from the moment of conception, there's growth and development. With adults, we typically assume that you're not exactly there, and I'm just an old adolescent. When I worked for Health and Human Services, I defined adolescents for the secretaries 5 years older than I, so that I would perpetually be in that category. But the assumption with adults is that you reach sort of a steady state plateau. Has anybody ever met a 70-kilogram white male? Probably. The reason I mention that is that's the standard reference on which everything is keyed. One, it's distorted because of the race, gender, assuming 70 kilograms. No clear age specificity. But the point being here is that kids are not little adults. So as you start to think about what you want to do, you have to learn about the children, the biology, the basics. And most programming and most ways in which we think about it are driven by that. I don't know if some of you can see. This looks better on the big screen. Describe what you see over there. Whoever can see it. A duck. And ducklings, a mama duck and little ducks, right? Can you see way back there or no? What's happening in this screen? You're sleeping already? We got another at least 20 minutes together. We decided that there's no wonderful television that you're missing. Who can see this? Who can describe this? Tim.
The little baby ducklings fell through the grate.
So how do you interpret this? How do you interpret this?
Falling through the cracks.
Falling through the cracks, okay, cliche, falling through the cracks. How else do you interpret this? Poor parenting, very interesting. Mom didn't recognize the hazard that was here, and because the little ducks are little, you have to think about the special kinds of concerns, risks, vulnerability. This looks better up here, so we'll get there. Children make up what proportion of our population? Just some basic characteristics. Anybody know? Anybody want to guess? It's a good guess. You might as well guess something, right?
20%?
20%. There's about, and here's an interesting issue. Children are fundamentally defined by what characteristic? Age. Age. Is age a good or bad criteria to define groups? Think about yourselves. Pick an age. It's 19. Are all 19-year-olds the same? Maturity, physically, hormonally? We use chronological age sort of as a summary indicator, but no, there's a huge variation even within age. So what's the definition even though I criticized it, what's the definition of age for children? What's the age grouping for children? 0, okay, we're 0. Good. When is 0? Well, it's an interesting question. Some people define it as minus 12 months. Because in anticipation of pregnancy, then there's 9 months of pregnancy, fetal growth and development, and lots of things, lots of vulnerability occurs during pregnancy. The mom's health affects the pregnancy outcome. So at the moment we're starting at 0, but some people have gone minus 9 months and minus 12 months. What's the upper bound? 60. The only real reason I raise this, who are the folks who have a sense of epidemiology? Oh, I saw something.
Oh.
Look at that.
Ta-da.
I don't know what they did.